Hello, I'm Dr. Ashmina Khalsa. I'm the Senior Consultant Obstetrician Gynaecologist at Cloud9 Hospital, Lucknow Division. So, can women with kidney diseases conceive? Kidney diseases, as we know, can be of many types. They can be of sudden onset or an acute onset, and they can be of chronic onset, which have been prolonging since many years. So, what are the types of kidney diseases? There can be certain conditions which have been precipitated, let's say by dehydration, by a certain drug, by a change in position, or maybe a use of a temporary medication. These would fall under something called a prerenal. There are certain specific kidney diseases which are because of some pathology inside the kidney, maybe in the glomerulus, maybe in the blood supply of the kidney, maybe in the tubules of the kidney, which actually are causing filtration and formation of the urine. Now, these conditions are the ones which have to be properly diagnosed, and some of them may even require a kidney biopsy or a renal biopsy for its diagnosis. There are also certain conditions which occur outside of the kidney, however, in the body, which are called extrarenal. Those can be in the form of stones, there can be some lymph node in the abdomen pressing on your ureter, it can be a small stricture, it can be a cervical lesion like a cervical fibroid or a cervical polyp which is causing a back pressure into the kidney. It can be a small stricture in the urethra, which is the last part of your urinary evacuation. Now, all these kidney diseases affect our serum creatinine levels, which happen to be the most important marker for an obstetrician to decide whether you can actually conceive or not. It is believed that 0.9 milligram per deciliter is the most higher upper limit of safe level of creatinine in a lady who is wanting to conceive or has conceived. So as a routine, we would like to always perform a serum creatinine in a lady who's come to me for a preconceptional counseling or early in her pregnancy so I can monitor. Now, what happens if this goes out of range? Now, if creatinine goes out of range, my most dreaded complication would be an abnormal rise in blood pressure. That is called a preeclampsia. So most of these patients who have a chronic kidney disease would already be on certain antihypertensive for the control of their blood pressure. So this condition becomes preeclampsia super added on a chronic hypertensive disorder. Again, a relatively serious condition, a condition which requires us to carefully monitor you throughout your pregnancy, a condition where you actually may be warranted to undergo a preterm labor or a preterm delivery. If in case with such condition, with serial growth scans along with our fetal medicine team, we find out that the growth of the baby starts lagging. So these are the mothers who actually end up having early deliveries, preterm deliveries, owing to two things: either growth restriction in the baby because the blood supply to the baby is hampered in view of the kidney disease, or the mother herself develops a high blood pressure or anemia, which warrants us to save the life of the mother or not to deteriorate it further. Pregnancy again is a very taxing condition on the kidneys, as the blood supply and the filtration process in pregnancy is absolutely increased. Now, in such patients who already have a compromised renal function, it becomes very imperative for an obstetrician to be very careful when allowing a pregnancy to occur in a kidney disease. So the end crux being, if you have a kidney disease, you need to be in regular touch with your physician, with your obstetrician, with your nephrologist, and then it should be a combined decision of the obstetrician and her treating team to allow you to get pregnant. There is another class of women who have probably, have donated a single kidney, let's say to the husband, to their dads, to a relative. These mothers, yes, can undergo a normal pregnancy. Normally, we don't have any problem in conception. However, any drug intake should be under the guidance of an obstetrician always. A third class of patients can be those who've had dialysis and undergone a renal transplant. So any lady with a renal transplant should not even think of conception for at least 3 years. 3 years is a time where we are very careful. If a graft rejection has to happen, would most commonly happen within the first 3 years of a transplant. Again, such patients should be under care of a high-risk pregnancy specialist and a combined team with a physician, with a nephrologist and an obstetrician.